world. So we want to know more about these teenage suicides, why they happen, and what people can do to prevent them. Joining us to talk about this morning is therapist Amy Manin. Amy, thanks a lot for joining us. You work with children.
Yes.
And one of the things a lot of people wonder about, especially when you're dealing with teen suicide, is why. What are some of the pressures that kids are dealing with that maybe most adults tend to dismiss?
I think the pressures are endless, and luckily it's not just pressures that contribute to suicide, but really at the heart of suicide is usually depression. So it's a combination of pressures plus the inability to be thinking clearly in that moment that you are feeling such psychological pain.
Mm-hmm. What are the societal drivers that are creating the depression? What's going on?
Well, I think it is societal drivers, but if you look at suicide rates over time, they've been fairly stable over the long history of the world. Unfortunately, 30,000 people a year in the U.S. commit suicide, which shocks me every time I think of that number. 4,000 of those are teens, and 400 of those are children between 10 and 14.
Wow.
So it is pressures, but if you think about how difficult life is, it's not just the pressures, it's the combination of then depression, mood changes, and then people can't think clearly, they get tunnel vision, and they feel pulled in that direction, that seems to be the only solution.
Do you find suicides more prevalent among males, females? Does it seem to matter?
The numbers of completed suicide is higher among males. The number of attempts is higher among females. So that's a big difference. And essentially, the more lethal methods you choose, the more likely you are to complete suicide. The piece that's interesting to me is that if your means of suicide is blocked in that moment, the majority of people do not go on to make a second attempt. So not having guns in the household is very important, not having immediate access to means especially for teens in that moment, who are likely to take action more impulsively.
So what are the signs that parents and friends should be looking for as a potential for leading to suicide?
I'll go over a couple. There are actually many, and I highly recommend the suicidology.org website, which gives a mnemonic to remember these. But certainly withdrawal is one of them. So that's a sign that kids can be depressed, and it's a sign that they are pulling away from family and friends and not accessing their support systems. Hopelessness is a big one, because a lot of teens are under a lot of pressure, but the hopelessness that they feel when they're depressed and the idea that things are not going to get better, that situation is just going to go on forever. And finally, mood change is a big one. So looking for signs that kids are more depressed, even if a child or a teen has a long history of depression, if they suddenly seem to, in the recent days or weeks, have a real lift and sense of relief, we need to be real careful, because sometimes they've just made a decision and they're getting more energy to act.
Tell us about the role of therapy in this, that parents recognize this but may not know where to go for help.
Therapy is very important, because when you're close to somebody, it's pretty hard to hear this news. So our first instinct when we hear that somebody's feeling suicidal is to kind of hope that that's not really true, that somebody's not really feeling that way. So it's very important for somebody who can really talk about this in depth, assess in depth, and begin to access concrete changes, one of which is medication for depression. There's a very high genetic, biological predisposition that is shown in most brains of people who end up making suicide attempts.
Amy, have you seen any increase amongst your own patients of this anxiety and this hopelessness because of what we're going through in this economic turmoil? Is that being transferred from the parents and impacting kids at all?
I haven't seen that real acutely. I certainly see more stress among adults, but remember that stress, a lot of us are under a lot of stress and pressure. It's really the combination of those other factors where somebody's really at risk for taking action.
I understand that research shows that most suicides that take place with teenagers occurs during the after-school hours and at home.
Yes, yeah.
What's that about?
Well, teens often don't have a means of transportation, etc. And again, remember that this is impulsive. So oftentimes if teens are going home, they're alone, they're getting in a depressed state, it's just more like where they're more likely to be than out and about. A lot of teens feel relief from depression when they're hanging out with friends. So, and by the way, for everybody out there, paying attention on Facebook and texting are very important. And a lot of teens say don't tell anybody.
Yeah.
You don't want to keep a secret if somebody ends up dying. So
The peer pressure must be unbelievable among the teens to keep a secret, not to be the one to snitch.
that's very true. Very true, but there's a high price to pay for that.
Yeah.
I mean, you cannot afford to take the chance that somebody won't act.
Are there types that you could put your fingers on of a child more likely to commit suicide than another?
The types actually go less with a certain group or type of person and more with psychological profiles of that particular person. A negative personal history. People feel like they don't have many social skills, that they're not really good at much. They identify as a loner. They have a family history of suicide. So it's really more a complete psychological profile.
Yeah. Before we go, you have a book that you want to mention
Yeah.
that's good for
I do.
parents.
I really think that this book is probably the #1 book I would recommend for somebody who is thinking about suicide or for people who want to help them in any way. And a lot of times people are comfortable reading a book when they're not quite ready to step into somebody's office and say how they're really feeling. So it's called Suicide: The Forever Decision, for those thinking about suicide and for those who know, love, or counsel them. It's very good.
Amy Manin, thank you so much for joining us.
Thank you.